The first question is from Mr. Tom. What changes have you seen in yoga research in the last 20 years?
Well, I mean, just the changes I showed you. I mean, the neuroimaging, the molecular biological changes, these were absent, I mean, before 20 years ago. We just had nothing like this before. And these are such powerful and objective techniques that they give us incredible precision. So this whole idea of, especially in the brain, the whole idea of the attention networks, the dorsolateral prefrontal cortex, we're coming up with enormous knowledge about how the neuroscience of meditation works. And then there's highlights that are just starting to appear. We're starting, as I said, the amount of research on pranayama is really remarkable. Just to give you one amazing example, there was a study that was done on rats. They conditioned these rats to slow breathe. So they had a population of rats that were breathing slowly and a population of rats that were breathing in their normal rate. Then they gave a stress test to both populations. The rats that were breathing slowly had a less stress response. So this is telling us that this whole idea of pranayama is not just in humans, it's actually in all mammals. It is that wired into our nervous systems. So these are remarkable findings that are telling us that these changes really can be investigated, and we can really understand, how we are experiencing these changes. So it really is a fascinating time in the field of yoga research, and the past 20 years has just been exponential in terms of the number of studies done and the kinds of remarkable findings that we're seeing. And it's both basic research and understanding how it works, but also the clinical research. For example, in the fields of yoga for cancer and yoga for low back pain, the societies that are involved in research on cancer and low back pain are now recommending yoga as a viable treatment based upon all of the clinical trials that have been done on yoga for cancer and yoga for low back pain. And my laboratory just recently published a trial of yoga for generalized anxiety disorder that was in a leading medical journal, JAMA Psychiatry. So it's really remarkable time in which we are seeing this really rapid growth of yoga research and our understanding of how yoga is working.
Yeah, as we are running out of time, I can take one last question. This is from Jennifer. How is yoga research and yoga therapy related to yoga practice?
Well, I mean, all of the research has yoga practice involved. And so there's many different styles of yoga. Different researchers have their preference of what they use. And of course, we're looking at different populations as well. I mean, a study on yoga for the elderly would most likely use chair yoga. And a study for low back pain would likely use practices that are going to be safe for low back patients, but probably also working on elements of the musculoskeletal system to help improve back pain. But the application of yoga is critical in the study because you need to do something in order to get a result. And then, of course, you can choose many different things to do within yoga. And so we have, oftentimes we will have yoga experts as part of the research team. And these yoga experts will then construct a yoga intervention that they believe, based upon their experience, is most beneficial for that particular condition or for that particular research goal. But it's very important to have very high quality yoga practice in order to get the benefit. So if you're bringing yoga into schools, there are certain constraints that you have to follow. If you're bringing yoga into the workplace, there are certain constraints that you have to follow. So it takes a lot of tinkering to really adjust the yoga intervention for the purposes of your research study.
This question is for Dr. Khalsa. Is it beneficial to consciously stop mind wandering?
Well, we stop mind wandering all the time. When you do any kind of task, you're immediately task-oriented and you're focused on that task. So if you're doing a math problem or you're playing a chess game, you're not mind wandering. In fact, you're impeding your game if you allow mind wandering to intrude in that kind of activity. So we consciously focus our attention all of the time. Now, mind wandering is not bad for you. Mind wandering is part of the way the brain works, and we don't want to stop mind wandering. We just want to avoid excessive mind wandering. We want to have some degree of self-regulation. We don't want to be in a situation where a person is saying, I can't control my thoughts, I'm constantly thinking about negative things. This leads ultimately to mental disorders like anxiety and depression, in which the thoughts are automatic and producing a lot of suffering. So this is where the whole idea of self-regulation of thought processes and the control of mind wandering, the ability to stop mind wandering, becomes valuable.
Okay, this question is for Dr. Srinath. For the summer course, if they select as an audit as an option, is it possible for the participants to get access to the recordings to view in case if they miss any of the sessions?
Unfortunately not. This is a synchronous only. The primary thing is that if you are on audit, then you listen to it and that's the end of it. But if you're in credit, then you get access to the LMS, you get access to all the previous recordings, and you get to complete your assignments and that get a 3 credit for yourself, and which you can either transfer to MS Yoga online with our program, or it could be exported to any university where you're going to be using it for credit there. And it is transferable as long as the other university accepts our credit. You can, if you want, you may want to check it with your host university to ensure that this is transferable. We'll be happy to provide you all information regarding that.
Okay, next question is for Dr. Khalsa. Can you elaborate on metacognition? What is it and why is it important?
So metacognition is the idea, the central idea is that you are not your thoughts. You have thoughts, but you are capable of stepping back and watching those thoughts move by and change, and a chain of thought from one thought to the next to the next to the next. The fact that you can step back and watch those thoughts go by means that you are not those thoughts. You have the ability to sort of step back. That's different than automatic behavior, in which you think and then that automatically is an action. There's no watcher. There's no separation between the thought processes and the your deeper self, which is this idea of meta. Meta means above. So it's really above cognition. And metacognition happens to be the most central construct behind the most powerful and common form of psychotherapy today, called cognitive behavioral therapy. In cognitive behavioral therapy, you learn to recognize your own thought processes. And it's typically applied in disorders. So for an anxiety disorder, for example, you're having anxious thoughts. Those thoughts are not just a symptom of the disease. They are actually the disease itself. And so if you're able to intervene and change those thought processes, you actually reduce the disease. So metacognition is very powerful and really involves this idea of self-regulation of thought processes. It's you, the higher you, that is able to self-regulate your own thought processes. So you take more ownership of your thought processes than you might have had before.